Okay, guys, once again, good morning, and thanks so much, Gloria, for asking us to do this presentation and this part two of the CBT for substance use disorder issues. Hopefully, you guys had a chance to uh, listen to and review the recording from part one of this and the slides that I will send over, Gloria, for this part two just after this is over, okay? But if you didn't, we'll have some practice time to kind of review what we talked about for part one as we then move to part two of this, which will actually be not only the initial discussions with clients when they first come to you with the idea potentially in their stages of change to get services as part of recovery, but also in starting their recovery. And as we said, the focus for this session is relapse prevention once they're in some type of recovery service or treatment. Okay. So the objectives that we have today will be a brief review of the motivational interviewing tips that we talked about last time, the CBT tips that we talked about last time that are part of initially discussing with someone about potentially getting into treatment and then starting services and care. This time we'll focus a lot more on the CBT part of relapse prevention. And there are two pieces that can be really helpful in working with your patients, not only ongoing care and part of their recovery, but also the role of mindfulness, which we didn't used to hear a lot about as little as 10 years ago, but now we know it's so much a part of focusing on the here and now and what's happening presently to be able to help in assisting someone in moving past what might be their temporary obstacle of a lapse in use and prevent it from moving to a full relapse or full resumption of substance use. And then the best thing that I have found in learning and how to practice and how to feel comfortable doing this with patients is role playing examples. So it looks like we've got a nice group. We'll be able to have some practice with me, some practice that we'll look at breaking out into groups to being able to do, and then coming back and processing what that felt like, what worked well, what didn't work well, what sounded corny saying, and how to make it just more natural as part of your engagement with your clients. So, as part of the review, remember always we're meeting the person where they are, understanding that we may have separate and differing realities, worlds, walks of life, and how we can try to empower persons not only to hear us, but also we empower a person in their conversation by listening to them, giving them the respect for their worldview and hearing what they're going through. So that a person feels that they can make these statements, particularly when we think about mental health and substance use issues, are emotionally laden to begin with. There's sadly lots of stigma, lots of shame, lots of cultural play, particularly for Black, brown persons of color, indigenous groups, to not share in some ways or to kind of hold these things, keeping these things in the closet or keeping these family secrets. And sadly, it's much of these family secrets that continue to perpetuate emotional issues and substance use. So when we communicate better, when we listen, and have people feeling like they're understood when they're talking about their current situations. And that in working together to help a person decide to make the changes really can help to make a difference in their own world. So let's do a little bit of practice for our stages in change and motivational interviewing. When we did our last session, we actually talked about our 32-year-old client who had a 3-year history of heroin use, who had recently taken an overdose and had to be revived by Narcan. So you're talking with her after she was discharged from the hospital after her Narcan reversal. She's unsure about if she wants help or treatment, but she knows that she needs help. So let's kind of review again in those stages of change questions what we want to ask. How do we help her to know what types of movement, what types of statements from moving through those stages of change can be helpful in helping her to come to that decision of starting some type of treatment. I've got some of the little highlights there, the who, what, when, and why questions of open-ended questions. Why do you want to make this change? How might you go about making this change? What are 3 reasons that you feel like that would be good for you to do it? And then how important? What do you think you'll be able to do? And helping someone to walk through those stages of change. So we remember that those open-ended questions are really helpful. I know everybody's got their mics and cameras off right now. It'd be really helpful though, if you don't mind turning on at least your mics, because this part is going to be from you. This isn't a sit and just listen. That we're going to learn, as we said, when we talk and interchange in this. Please open your mics, and I'm going to play the role of the person here, the 32-year-old client. Let's look at, in looking at those stages of change questions, and these are a reminder from the responses, what would that conversation look like? Let's incorporate some of those stages of change questions as you're talking to me. The person has just been discharged out of the hospital right now. So based on my case, knowing that I need treatment, but not sure if I'm wanting to go, what stage might I be in? Let's start there, somebody.
Maybe contemplation.
Good, good. Because I'm thinking about change, but I'm not really quite sure. I'm not really certain. Excellent there. So, what would be an example of an open-ended question that you would talk to provide that intervention approach there? The immediate benefits of quitting for yourself or your loved ones, emphasizing your health, the economic and interpersonal benefits and payoffs of looking at being able to move forward with a treatment program. Someone start to the role, we'll do some role playing, and you guys can ask questions. I'll respond as the patient.
This is Richard. My first question to you, do you have any?
Oh, did we lose you, Richard?
Richard, you're on mute.
There you go.
Did anybody hear my question?
Can you repeat it? We lost you there for a minute.
Yeah, I'm sorry. My question would be to you would be what does it look like for you 2 years from now?
That's an excellent question. That's an excellent question. You know, I don't know. I don't want to be dead, and I know I've lost so many other people during this time. I'd like to be able to say I could get my life back together. I could have a place to live again, and I could start, you know, trying to just have a regular life out of this cycle in 2 years.
Okay, what does that look like for you?
Oh, wow. I don't know. I feel so overwhelmed right now about everything that just happened. It just is blowing my mind, even just thinking that I really could have just died.
Okay.
I guess I could just be clean, maybe, or not, or I could be clean and not using. That'd be my only hope. I just came so
Okay.
close this time.
And that is an attainable goal. How do you feel about going to meetings, being around people who understand you?
Uh, I don't know. Will they talk about me, or will they say that I messed up, or sometimes even when I was at the hospital, they were looking at me funny, like you're taking up space at the hospital. I just worry that they just be judging me.
No. Well, that's a judge-free zone. Reason being, I'm speaking from experience, long-lived recovery, um, 25 years of sobriety, um, 20 plus years of using. I can guarantee that it wouldn't be any stereotyping or demoralizing statements towards you.
That may help. That may help. And Richard, that was a really good response, putting in your own personal experience there. You sometimes want to be a little bit careful saying 100% guarantee,
Yes, yes.
because unfortunately life happens, and we don't accidentally want to put that perfect world, because the client already knows it's not a perfect world. But even being able to say, hey, what if I went with you to your first meeting,
Yes.
that you could see that it was a safe environment, that may actually give the client, okay, he's going to be there, and I know that Richard's not judging me. If something happens, I know I can have him to lean on. That's a little bit less where you're potentially giving them that it's going to be perfect, and sadly that may not happen. But the way that you asked those questions, those were great. Those were great questions. Someone else.
I do like the question that you have here. What would it take for you to get help now? Because I think that's a good question for someone to think about. And maybe sometimes we just need to ask that question to kind of see, what that response would be or
You know,
how we can help them even further.
that's a really good response. That's why from these folks that have studied stages of change, when you think about it, each question tries to lead the person to the next stage. The pre-contemplation questions, what would it take for you to consider seeking help? Well, they're like, well, what would be the next step to get to the contemplation part of starting to seek help? So those are great. That's a great question. Well, just goodness, just almost having died, and when they said that they had to give me like doses of Narcan before I even like came to, that's really scary. That was really scary. I don't know that I want to go to some place for 30 days though, because I mean, I've got my stuff. I've been staying at a friend's house. I'd lose all my stuff. I was trying to start to, work a little bit part-time. I would just lose that job.
Well, I would go ahead and say once they're talking about their part-time job, um, just focusing on if you continue using, do you think that you'll be able to be stable enough to remain in your job?
That's
I
a good
mean,
question. Yeah,
as
that's a
far
good
as your stuff,
question.
if you're staying at a friend's, that friend should not mind if you leave your stuff there.
Great. So what's an open-ended way of asking what you just said?
Okay.
Mm.
Um, do you think that you would remain in your job if you continued to use, and where would that lead you?
Okay, but think about that one with the do you. That's kind of a yes, no question, but
Yeah,
that was moving in the right direction. I would probably hit the second one that you said. So how would we be able to make sure that your stuff was safe if you went while you went to treatment? Because that's an
yeah,
open-ended question, and you're basically just like what you gave the answer, but you're helping the person. The client has to see the answer. You
right.
know, you know what the answer is. If the person someone's already letting you kind of couch surf with them, you close enough with them that they may keep your stuff. But you got to have the client get that light bulb click. How could your things be safe at your how could we keep your things safe if you went into treatment?
Mhm.
Or
Right.
how are you going to manage your job while you're still using? See how that's open ended, because the do
Yeah,
you is asking for a yes or no. The
right.
so I hear you. I hear what you're saying. How are you going to keep your job when you're using as much as you're using right now? How is that going to work? What's that going to look like? So all of those are open ended questions, and asking the person, well, yeah, I did miss out the other day because I was sick and I couldn't show up for work. You're right. Um, Maybe if I went to somewhere for just a short time, I could ask my friend if she could keep my things for me safe at her house.
Yeah. It's if it's just for a short time, have you considered detox, that kind of thing?
That's a good question, but that's also have you is a yes or no question. But you really have to reframe your brain to kind of, let's talk about the different options for treatment.
Yeah.
Not all treatment is a 30-day treatment. There's some places that you might just need to be, overnight, or might just, need to come in as you are, and they can get you started on on medication, and you may not even need to stay depending on what your use pattern is. They can ask you about how tough it's been for you to not use, or if you might be a candidate for one of the new medication assisted recovery medications that you could start right there on an outpatient setting, or even sometimes be able to start at your house.
Yeah.
So you see how you said the question. It's just remembering how to say it and asking, is it all right if I talk with you about a medication called Suboxone? Have you heard of that?
Right. Right.
Yeah. Oh, yeah, they were sometimes people sell that on the street, like if you're starting to go into if you can't find any drugs, because then, you don't want to go into withdrawals. I've had some people buy it's like something that melts in your mouth. Is that what you're talking about?
Yeah, and in sitting in an outpatient setting and getting on medication would allow you to continue working your job. How does that sound to you? Is it something you might be interested in?
Excellent question. Excellently phrased perfectly, Jacob. You know, wow. I mean, that's something where I could like get started in treatment and not have to, miss work, and I could still my friend just might have to watch my things for a day or so.
Yeah, yeah,
So you see how when you change the way that you ask questions, you already know a lot of those answers, but the client, unless they come up with it themselves to move forward, it's going to be a little tougher for them to move forward with it. But
right. And especially when they're in that situation, a lot of individuals don't know where to even start.
Start.
exactly, exactly. And if you think about Maslow's hierarchy of need, have you guys heard of that before?
Yes.
Yes.
So if I'm still figuring out what I'm going to do about living today, even next week might be a little bit mind blowing or
Oh,
overwhelming.
yeah, yeah,
You know,
overwhelming.
Absolutely.
Yes.
so you might want to just parse it in little short increments. Hey, what do we need to do to help you today? What do we need to do to help you to make it through today? What needs to
Yeah.
happen today? And that's when you can really earn the trust for somebody, because their mind is, okay, I just overdosed and now I feel really rough because they just gave me Narcan. I'm about to go use right now. If you don't get out, if you as soon as you walk out the door, I'm looking.
Yeah.
So so that's a great. What do we need to do to help you make it through this day?
Mm.
So now continuing with those open-ended questions, we're going to expand it a little bit more. So as I'm talking and you hear you now you guys are going to reflectively listen. What are those things that you're saying, hey, understanding where I'm coming from and meeting me where I'm at, and even summarizing when you hear me with some motivation towards treatment, being able to move to that. So now you move me to preparation. Wow, I can go somewhere and maybe get started on something. And then do I have to come there every day for treatment? Do I have to be there every day at 5 o'clock? Because sometimes there's a treatment that people go to, but it almost makes them seem like they're almost hooked because they got to go there and be there at 5 in the morning. It looks like almost punishment. Is that what I'm gonna have to do? Ben, your turn.
Not, yeah.
You give it a try, Ben.
I'm sorry, I'm a little lost here, but I'm not sure where.
So we've been asking open-ended questions. Now
Uh-huh.
we're going to give some affirmations and listening to my emotion when I say those concerns that I may have.
Oh, okay.
Okay.
Well, I guess to validate your concerns, I understand that you're worried about your things, that you're worried about what's going to happen to you next, and what it's going to be like in treatment. And my question for you is, well, what do you think it might be like, and how might we get a clearer answer to those questions?
Okay. Well, like I said, there was a friend of mine who takes. It's not that thing, the Boxone that you mentioned. I think they're taking methadone. But they have to go there at 5 o'clock every morning. It wasn't until COVID that they didn't have to go there every morning, every morning. Am I going to have to go there every morning, every morning? I mean, that's kind of almost like punishment, like I'm back in school.
Yeah, yeah, it does sound. That's pretty early in the morning. It does sound kind of punishing. Is there a way that you could find out better information, like firsthand information? In other words, is there somebody you could call or talk to that would know more? Is there somebody that you would like me to call and talk to? At the rehab or the methadone center, we could sit together and find out more. So we're not going on hearsay. We're getting the information firsthand.
Okay, okay. Good save there, Ben. I was literally, you know, and it's okay to say when you if and I'll do this for I don't know everything that's involved with the Suboxone.
Yes.
I'm
Yes.
happy to get on the phone with you and sit and talk to somebody from the office, and we could come up with questions to ask them. What would you want to ask them about? And you see how now you're moving them forward.
Yeah.
So I knew where you were going, but then yeah, I don't know, I'm just learning more about that. They're just getting where there are people out in our area now that do Suboxone, but I can sit on the phone with you and learn myself. We can both ask the questions, and that's another way of supporting the client in there as well too.
Yes.
Save. And then what are you going to say okay, so they'll tell me about what the Suboxone is and what I'll have to do?
Yeah, that sounds good to me. If we could speak with someone, who is at these centers, whether it's a rehab or a detox or whatever, we can get specific information. Can we write down specific questions that you might have before we get on the phone?
Okay, because I want to know, like, well, one, I have Medicaid. Will my Medicaid cover it? Um, if I pop a dirty drug screen, will they kick me out of the program?
Okay. Well, I'm
And
writing
that's
these things down. Yeah.
okay.
And these sound like terrific questions.
And that's a good opportunity then, Ben, to also involve your harm reduction. Hey, in the past, they used to call them dirty or clean or things like that. And what we found out is that actually makes the person feel dirty or clean. And that's not what we really want to do. But for many of the programs now, they actually use a method that we call harm reduction. We'd rather have you taking the medication, and even if you may slip and use, we don't want you to then all of a sudden be, cut off cold turkey, because we know that you're at higher risk to overdose if someone leaves a program like that with nothing to support them at all. But we can ask for more details on that so you can feel more sure about it. You see how you move them, but also you're treating them, because sadly, the stigma and the shame becomes such a pervasive part, then the person ends up showing that same stigma and shame, and then that becomes another issue in their own feelings of poor self-esteem. So good move for that. And so now I'm almost ready for action. And this was something we talked about last time. How do we do the cost benefits? What are the pros and cons? So Danny or Eric, you guys want to help walk me through the pros or cons? Now, Ben, that counselor Ben told me that we're going to talk to somebody about getting started on this medication, but I kind of worry, if I start on this medication, is it just kind of like, switching the heroin or the fentanyl to now this medication? Is it just like switching from one drug to another, Richard?
I personally, I don't know, but we can do a little bit more research, dig in depth of what your concerns are. But I'm quite sure that we can come up with a definitive answer.
Absolutely.
A definitive answer to your question.
Good response. Another response using that cost benefit analysis could also be, well, we know if you're taking the medication, and that part of that is also learning the medication too. So if you guys want us to come and give a talk about what the different medication assisted treatment options are, so you'll have a number of these questions for your patients, we'll have to do that. Got to make my plug, Gloria. But also, when you use the cost benefit analysis, well, if you're taking a medication that's going to help you to not use, and then it's going to also keep you from overdosing, well, that sounds like that might be a better pro than potentially using, where you might get a hold of some fentanyl again. Tell me what you think about that. And you see, then you're having the client basically look at the pros and cons. The pros of maybe going in and getting help. And I'm afraid I can't see the chat, so I'm trying to click over to see that. Okay, Danny. But you want to have the client then understanding, okay, what are the advantages to look at getting services or treatment or changing their behavior, and the disadvantages of continuing. So you're doing like a pro-con list on this.
Yes.
Okay.
Now, this would be something that if I were with a client, that I would just kind of sit with an empty page and say, what are your advantages of continuing?
Exactly. Have them have it in hand. because this will be, and we'll go on with this one in just a little bit when we talk about some other relapse prevention methods. This is going to be one of your best tools for relapse prevention, is having the client look at their pros and cons and having it placed anywhere they need to that could be a trigger. Literally, when we work with clients who have eating disorders issues or may overeat from emotion, we have a pros and cons list on the refrigerator door, so that they can look at, okay, my pros of getting this. Am I eating right now because I'm hungry, or am I eating because I'm bored, or because I'm nervous or stressed, or because I can't sleep? Okay, if it's any one of those other than feeling hungry, what can I do instead? Because then you're helping the client learn what are those potential triggers and how can we move forward in that. Was this helpful for you guys going over these?
Yeah.
Yeah.
Very
Yes,
helpful for
very.
me. Very helpful. Very
Okay. Oops. All right. So right now I've gotten started. Ben and Richard took me over to Point there that does Suboxone, and now I'm getting started in treatment, and I'm on Suboxone. And now I'm kind of worried because I'm getting ready to go and visit a cousin in Indiana, and I know that I used to use with that cousin. So I'm a little worried that if I go there to visit, although I want to go and see her, that I might use. How can we use, and this was one of the CBT principles that we talked about: antecedent, what happens before, the behavior, which would be the substance use, and the consequence. How can we talk about helping me to not feel triggered to use when I go to visit my cousin?
Oh, one of the methods that I use is, hey, how about if you really want to go to this cousin? I know you've used with him. How about you taking someone that's practicing sobriety, take them with you. Always have an escape plan. When you feel triggered, you up and leave. No excuses. Even in fact, how about if I go with you?
That's a really good option. That's a really good response. Let me put it in this antecedent behavioral consequence, and you can see how you can really use it in a good way, as just as you're stating. Okay, so what happens when you're with her sometimes that may trigger you to start to feel like you want to use?
Sure.
Okay, then that's your escape, and you said it, your escape plan. So when you see that activity happening, and what happens the last time what happened? Well, I went with her before and we were doing okay, but honestly, then her boyfriend came over and he was high, and so when he came over high and he offered some to us. Okay, so if you go there this time, how can you use your escape plan to make sure that you don't relapse? Well, if he comes over, then I could say, "Oh, wait, okay, well, I might need to go." Or if you, Richard, you were gonna visit with me, I'd kind of let you know.
Yeah, and it's time to go. It's time to go. It's just
Yeah.
it's just time to go.
So I could let you know that
Yeah,
guy.
yeah,
And you could say, okay. So you're basically showing them, and this is what the key is. You want the client to learn what their triggers
yes,
are. And a lot of times
yes.
they don't know.
Don't know.
Think about asking your clients, or honestly, think about asking yourselves. Sometimes I used and I didn't even understand the cues of what was happening. I can't even tell you
Yes,
what happened. So you have to kind of go back and break it down for them. So what was happening? What's the last thing you remember? Oh, yeah, so and so's boyfriend came. Yeah, yeah, he was messed up. He was messed up. And then what happened? And you'll have to kind of process it through them, because that stream of being immediately triggered and going straight to
trigger.
use might happen so
Yes,
quickly that people
happen.
don't always remember that there were multiple steps where they may have been able to intervene, but they didn't know at the time. You're going to help them to be able to walk through that triggering, walking through that initial reluctance they had, then their feeling of shame or self-esteem. I'm just a junkie. I'm going to go ahead and use. You can help them to
Mm.
kind of piece through that, to looking at those antecedents. Where was I when I was at my cousin's house? What was I thinking? Oh, and he came in and he was messed up. Oh, and then he had said he had done some black tar heroin. And I remember I had a real rough trip one time when I did some black tar heroin, but it kind of felt good at the first
It,
off, but then it felt bad. Okay, so right then and there, how are you feeling? Well, I was starting to kind of feel jonesing for it, thinking, oh wow, yeah, that was some good stuff. So you see how that analysis of the antecedents
yeah,
helps you to kind of even recreate those to what happened for the patient because they may not recognize it. You have to remember to help them with deep breathing and help them with relaxation during the process because sometimes even going back and picking out what the antecedents were might be triggering.
yes,
And so you'll say, hey, I'm asking you this to kind of find out what your triggers might be. If you accidentally start feeling, and what a trigger is what's the stuff that gets us to go and want to go use. If all of a sudden you're starting to feel that way, let me know because we've already practiced some deep breathing, some relaxation. We've got some things that we can do because you need to learn to be able to do those so that you can have more days without use.
I
That's
think
a
one of
And
the it's another
if I,
question that go ahead, go ahead.
no, I was just thinking, it's Eric, I'm sorry.
Yeah,
I remember early on in my recovery,
Mhm.
I would tell on myself because people didn't know I was in recovery. So I would
right.
let them know that I'm in recovery,
Mhm.
and oftentimes they would respect that
Yeah.
because
Okay.
people are going to continue to use because that's what they do. Now I'm in their environment.
Mhm.
So I had to say, hey, you know what? I'm not, and they respected it, but I had to tell them myself first.
And that's what self as a therapy tool is so helpful. That's why we know that peer recovery and persons who have been there and now at a different places are so helpful as part of this because one, the client immediately sees you as one person that they know that's overcoming and that's in
Mhm,
recovery.
mhm,
Two, you can help them to kind of piece together some of those pieces that they lost. And you may even
mhm,
say, hey, I know mine for me was if there was something stressful happening
mhm.
or something stressful at work and I can't and I noticed all of a sudden I got worried or I start sitting and be worried about something and all of a sudden the next thing I knew I was using.
Yeah.
Oh yeah, when I worry, I use a lot too because we may not have good coping skills for worry or anxiety, or if
Mhm.
there was something traumatic that we observed. Oh yeah, I heard on the news that somebody had gotten shot, and I remember seeing my good friend getting shot right in front of me, and that just really set me off. So being able to say, "Hey, I'd had one of those experiences too," and being able to connect with them on that level is really helpful in moving them forward in a positive way.
Mhm.
Yeah. One of the things that I had to practice also in my early recovery is association. Certain people are triggers.
Right.
Certain people and places. Um, and but go back to your initial with the client accent. Is it
Mhm.
okay that I go to my cousin's house and everything like that? I think okay. What do you associate? Is you going to see about her well being, or is that a place where you used to use regularly?
Yeah.
Yep. What's your business there?
Yeah.
You
Yeah,
know,
yeah,
the
Mhm.
positive. If you
Mhm.
did say, I'm trying to stay straight, I'm trying to do good, would you respect the fact that, what I'm saying, I don't want to see it and please don't, would your cousin respect that?
Exactly. That's a really great way to say it because then you can ask, so that's part of that the antecedents. So how you now you wanted to go and see your cousin? Tell me what's your plans to go and see her for it. And it's okay to say.
exactly.
And it's okay to say. So, and we want to move away from the confrontational point of it. So, what are you going to do while you're there? We don't want to be all in the face with things. But so what? Okay. And it's okay to say because I know sometimes there were folks that were good for us some of the time. There's some folks that aren't good with us some of the time. Part of what you're going to need to start to think through in your recovery is who's good for us at what times and how to be able to take care of me through the good times and the not so good times. Because people who may have these issues with self esteem, if the cousin says, no, you're going to leave now, how are they going to get that
Yes,
confidence to say, no, I need to go. I need to go to take care of me? Because are they used to taking care of themselves? No. Are they used to being able to say no? No. So you're helping them in this decision making. That was our next review. We told this was part of the last presentation too. The decision making on, hey, should I even go, or am I going to think that if I go, oh my goodness, if I go, am I gonna end up reusing, or if I feel like I can't go to nowhere at all anymore because anywhere I go, I'm gonna lose. That type of talking is catastrophizing, right? It's all or nothing.
Yes.
That's
Yes.
part of that. That's part of our the thinking framework. Well, I'm just gonna have to stay in my house all by myself then, because I can't go and be anywhere unless I'm gonna use. Well, let's actually break that down a little bit, because is that actually 100% true that we're gonna have to wrap you in a cocoon, and we'll talk about this in a second, because we're gonna have to wrap you in a cocoon, and say, okay, well, we'll see you in 10 years, and you'll say you have 10 years sober. No, 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 no. But it does mean that we're going to have to start thinking through where we can be safely, where we might need to go with a buddy. What are our safe words to ourselves and our own recovery? And are we going to be able to stay safe for ourselves? So that's part of what this last part that we're going to review is, that negative thinking, that all or nothing thinking. What's the problem? Identifying the problem. I want to go to visit my cousin, but I don't know if I can stay sober while I'm there. What are the possible solutions? Well, Richard said he can come with me, so I could kind of like let him know if I start to feel triggered. What can we implement that solution? Okay, yeah, he said he'll drive me over there. It's just Michigan City, or it's not that far. And then we can process afterward, how well did it work?
Yes.
And you hear your clients coming up with, oh man, I've been on this medication now, 2 weeks, and it's been so tough not to use. Well, there's a couple of things. Are you still having some cravings? Because that mean that they're still working with you on your dose. No, I just feel like I'm gonna mess up. I feel like I'm gonna F it up. I'm good at only one thing, effing things up. Well, what is that really true? Because I saw you did a drawing the other day, and you wrote a poem about your recovery. That poem didn't sound effed up. That drawing sounded good. Is everything that you do messed up? No. And then asking, what's the worst thing that can happen if that's what you believe? Well, I'm just gonna be a failure. What's the best thing that can happen if you're wrong?
Right, right. It seems to be that you're successful in working your way through difficult situations.
Exactly.
So, use that to benefit,
Exactly.
because you
Exactly.
can make it because you're making it.
Mm-hmm. Yeah. Wait, now, how many days have you not used? Well,
Exactly.
this is my 10th day not using. Oh my gosh, how did you do that?
Yeah.
And I ask, how have you made it through 10? Well, I've been talking with you, and yeah, so you've been doing things for you not to use, because I haven't been with you 24/7, right? No, you haven't. So you've been doing things to be able to help you to not use. What have you done? What did you do yesterday so that you didn't use? Oh, well, I changed my route going somewhere. I was gonna
Mhm.
look different, and I changed my route because I knew that on that corner that wasn't a good corner for me. Oh wow, that's excellent. And then you reward that, because clients don't see those little steps that they're taking as
Yes.
really big
Yes.
steps. I mean, even just saying I didn't go down that block so I wouldn't come up on somebody I know is going to have some stash there. So you help keep yourself sober that yesterday. You
And
did.
I also think that it is, you said rewarding. I think it's a good thing that we give them affirmation, that they receive affirmations. Hey, remember how you was when you first had a conversation with me, opposed to like to 10 days ago to till now?
Exactly.
You're thinking a little bit more positive.
Mm-hmm.
You like you said, you ain't been around me every day. You've been calling people
Right.
that's
Going to your
connected
group.
in, yeah, going to your group, and you have made some new friends,
Oh
which
wow.
you didn't have that 10 days ago.
Exactly. Because clients, they don't, it's all or nothing. They're either doing it
Yeah,
100%
yeah,
right, or they're messing up. So you got to get them seeing those steps along the way. So that's
yes.
really, really important. Now we're going to talk about just some of the additional steps. You guys are learning and seeing a lot of ways that you can kind of work on clients' thought processes and their behaviors toward treatment and change. Now let's work on that stage of change during maintenance. What are the things that we can do to help prevent an initial lapse, the first lapse, and to keep the one-time lapse from going back to a full resumption of use? Because you're still thinking and working with someone who thinks got to do it 100% or I can't do it at all. And that is part of that CBT behavioral that will need to be changing. So we know that we can focus on just really some key concepts on that. Use and create a low risk schedule. Just like we said, even going a different way to work or going a different way to avoid a corner that might be triggering. Recognizing where the high use patterns or times were. For sometimes it might be right around the end of the month because I'm trying to figure out how the money might stretch. And I'll start to get stressed about, am I going to have enough money to the first of the month or to my Friday paycheck coming up? It's just Tuesday. And what'll happen, we'll blow it, and then we surely don't have money for the rest of the week. So, little things like that might be triggers for clients. Finding out what those triggers are, helping them to avoid those areas, those situations, learning new coping techniques instead of using a substance instead, helping them to build their knowledge around substance use disorder, and that the substance use disorder itself perpetuates that all or nothing thinking. You either got it 100% or you're messed up. Well, no, we know that that's not true. Your brain is telling you that you got it 100% right or you got it messed up. Teaching clients about triggers or cravings. Because when they clip, I'm feeling a craving, that means this medication isn't working. We may need to adjust the dose, but it doesn't mean that it's not working at all. You need to quit it. We need to go to talk to your prescriber, your doctor. I'm having a trigger. That means I messed up. Dang. And then you'll see a lot of anger. And you might see that anger come out as in cursing you or getting upset or starting to throw stuff. I'm messing up. I'm not doing it right because we don't have good coping skills. Well, first off, let's calm down. Let's talk about it and let's see what we need to do next. Now we're going to talk about some ways to really see how to do things next. We know that the best way to get things done consistently and successfully is conditioning. Just like we teach our dog to sit down and we reward them with a cookie, just like we go to work Monday through Friday because this Friday coming up is going to be a cookie, your payday. We train our kids. Okay, you do your, make up your bed, clean up your room, and you'll get your allowance at the end of the week. We're just conditioning people to know if they keep up a certain structure or schedule that they'll get a positive reward at the end. Now we want to have a client relearn that the positive reward is not the substance use or the high, it's the days not using, are their own positives that they can put in between that. So we use that modeling so that we imitate. You as a peer will be imitating, hey, this is somebody who's keeping it together. I'm going to follow their example. With conditioning, we want to show role models that aren't using, because sadly, many people who have substance use issues may have had parents that use. So that's how they didn't learn how to cope with stress except for using. And then they're learning new skills that you'll be teaching them, and even going through role play. I role play with clients just like I'm role playing with you guys. So that, okay, so what happens when someone says this? Oh, well, I'm going to respond with, okay, no, we're not going to argue. I'm going to go and take a timeout because I don't want to get upset. Okay, what's that timeout going to look like? And you actually can role play in your office with someone about how to walk through those steps of not making the decisions to move towards a substance use. Mindfulness is another great way to help with relapse prevention. The inventor of mindfulness, Dr. Kabat-Zinn, says that mindfulness is simply paying attention in a particular way, on purpose, in the present moment, here and now, and not judging. And when you think about that, that's almost the opposite of what clients may be doing sometimes, particularly when they're in a use parent. They're not paying attention to anything. They kind of forgetting. Frequently the use is to get away from what may be happening at the moment, if it's trauma or bad memories in their mind or feeling triggered. They're not focusing on the present moment. And sadly, after they use, the judgment is frequently on themselves. So when we set mindfulness on purpose, so we want to actually take steps to say we're taking the steps to calm ourselves. At the present, I'm just going to think about right now. not the past or the future. You know, frequently our clients will tell us about all the things in their past that means that they're bad right now, but can we change anything in our past? No. We can only focus on what happens today so that our future steps will be better. And we focus with non-judgment. The stigma and shame, we've got to pull that out of the way. And that those thought prep patterns aren't helpful to you anymore. So supporting someone, being aware of their triggers, the patterns of their use or their reactions when they do use, that helps them to say, okay, what are the things I can do right now when I feel triggered so I can choose a better response? And there's really, I like to give nice, simple ways of saying, what are the things that we can do for that? The 5 W's for that functional analysis. So when I show you that functional analysis page, you're like, oh yeah, I remember that. When? What was going on before you used, before you felt like using? Where? Where were you going to go to look at obtaining drugs? Why? How are you feeling when you started feeling triggered? I started feeling scared, or I felt like that little girl when my dad was beating my mom and I just had to hide in the corner so he wouldn't hit me too. With whom were you using? If there's a pattern where you frequently use with a friend, like a cousin. And then what happened after? Because then you can help someone focus on the present and then make a decision not to use. So remember that functional analysis? We talked about those before and after and talking about feelings. Where were you when you started to feel anxious, like you might want to use? Who was with you? What was happening? Now you're teaching them beforehand to look at identifying what those thoughts and triggers might be, how the person might feel, and how to focus on their being right here in the present and grounded in the present to prevent them from looking at the substance to try to help change those feelings or negative sensations that they have. And when we talk about triggers, or when you even think about your own triggers, they're usually a negative feeling, a negative emotion, or a negative sensation or signal that you have that happens in your own body. It feels uncomfortable. We don't know how to look at changing that feeling. And so we unfortunately may start to use substances to look at changing how that may feel. And now what can you do differently? Rather than using the substance as a behavior, what can you do differently to help that? If I'm nervous or anxious, I might be able to use something like 4-square breathing. If I'm feeling sad, or I might listen to some popular music. Turn on Earth, Wind, and Fire's September. That'll always change my mood. And helping people to already come up with things that they can do to put themselves in a better frame of mind mentally and emotionally. And then and then how did you feel afterwards? I calmed down afterwards and I didn't have to use. Or I was able to do that grounding that you talked to me about, identify one thing I could see, one thing I could hear, one thing I can taste, one thing I could touch. And it helped me know that I was safe. I wasn't back to being that little girl hearing my parents argue or fight. And so I didn't have that triggering. And you see how you can actually train your client and work with your client to learn how to move through those triggers without relapsing. Does that make sense, guys? Do those statements,
Yes.
those types of techniques sound familiar too? There are many
Very.
of them that you may know: body scanning, we call them breath awareness, mountain meditation, starting thinking about your problem being the biggest part of the mountain. And then little by little, you're climbing up one step of that mountain. You're getting closer to the top. And then you're climbing up that one step of the mountain, and see yourself being able to sit at the top of that mountain and not having used. And now you can collapse that mountain down with your hands. And you can actually teach clients how to use these coping skills techniques. And I'll give you a link to some of these if some of these are new or you haven't heard of. But walking meditation, we do that frequently. Walking, singing, listening to music, any types of thing that may help you with how you're feeling and helping to place you back in the right now, not being judged or feeling judgment or feeling that self-esteem negativity, and being able to focus just on the present. Those are great ways to be able to use to help with improving what we know from CBT, or those negative core beliefs that people may have from their life experiences, usually issues with trauma, or triggering may occur, and it's interpreted through their beliefs. Oh, something bad's about to happen. I feel like I'm back when I was little again. Or sadly, many people experience trauma while they're using. They may be subject to rape or other types of abuse while they're in their use pattern, so that they may feel those triggers again. Those internal feelings rise up. They don't know how to control them. They don't know what they might be able to do to help those behaviors be more helpful. And then that cycle kind of continues, that kind of unfortunately enforces the use of a substance. So when you use and instead place those, um, oops, I went the wrong way. Those mindfulness activities, you can actually help them to overcome a number of those negative core beliefs that people may have. And when we think about those, they're from our own issues, from a trigger, a fight, our negative worldview. If we grew up in issues with poverty, discrimination, other issues, feeling that life wasn't fair, I deserve something better, that helped, that then made you feel angry, frustrated, or hopeless. And so your action was then to cope by using. Now, what you want to do is that when they have those feelings, you want them to use a more directive activity. So you want them to use something that's part of those relaxation activities, part of that response prevention and relapse prevention, so that they no longer take that action of using a substance. The cost benefit analysis is a great way to help people do those. What are the pros of a relaxation technique versus the cons of a relapse or use? Helping people walk through that. And as you said, Ben, actually having it written down, having it where they can go through it. When you start to feel, what can you do? If I'm clear-headed, if I'm not using, my relationships will get better. I'll be more productive at work. I'll feel fitter. I'll feel healthier. I'll feel better about myself. And those cost benefit tools, this is a great slide to be able to use and have clients write down so that they can find those better ways of coping with stress, anxiety, or triggers. So now let's practice these. So once again, we just went over several of them. Now I'm coming back to you guys for follow-up visits. I've been on Suboxone now for 2 months since that last overdose, and you guys taught me into getting treatment. Now, oh, we already used this. We actually was looking at going to visit a cousin in Indiana. I'm gonna guess I'm gonna go visit another cousin in Indiana. But you know, over there in Indiana, there's lots of heroin and methamphetamine. So what am I gonna do? What am I gonna do this time? How are you guys gonna use that decision-making tree, the relaxation and response prevention activities that we just talked about? What are some ways that you can talk with me and get me primed to be able to do this? Because Richard said he can't come with me this time to go visit this other cousin. Who's asking me? If you want, let's think about that. Maybe I'll leave that tool up. That may help you to think about what the questions you may want to ask.
So would this be a time where we would sit with the client and kind of, talk to them about what their activities are going to look like being with their cousin in Indiana, and kind of talk to them about past behaviors, basically using this tool here?
Exactly. Or even has been, so, okay, so let's remember that schedule, that routine, so you can help. We talked about how to kind of reorient someone. So let's write down a schedule for your day. What time are you gonna take the bus or the train to go over there? I'm gonna get on this bus to head over there. And then what are you gonna do? Well, she's gonna pick me up at the bus station. All right, then what are you guys gonna do then? Well, then she wanted to go and take me by to see my grandmother, because I hadn't seen her in a good while. This will be the first time I've seen her in recovery. I think she'll be real happy to see me. Okay, and then what are you going to do after that? So you're basically walking them through the schedule.
Okay.
That's a good way to start. And then what are the advantages of being able to stay in your recovery while you're there? Now these are written from the use versus not use, but you can use that cost benefit analysis for any kind of decision. Okay, so what if you go by that other cousin that Richard had to help you with, and her boyfriend shows up? Oh, well then, okay, Richard's not gonna be there, but I can text you. I can text you for my peer support, so you can kind of ask what are the things that you can do.
So this is kind of a rehearsal. Oops, I'm sorry.
Go ahead.
That's all I wanted to say. It's just kind of a rehearsal, kind of playing scenarios out, seeing what could possibly happen, questioning, well, why are you going there anyway? And what is your business, and what is that business, and what do you need to do to have that business? And what if something happens while you're doing that business, to kind of have a little like cachet of things, So
Well, I
you can
want my
visit.
grandmom to see me clean. This will be the first time she's seen me not using it in goodness over 3 years. So I know she'll be happy to see me.
And
Right. Ask them if there's someone that supports your recovery that you can hang out with in the meantime, like while you're there. That way, you know, you got somebody reinforcing what you want for your life.
Excellent. So my aunt's gonna be there. My grandmother lives with my auntie, so she's gonna be there, and she knows what I've been going through. I've been, talking to her. She, how you asked me to make that list of people I can call if I started to feel stressed. She's on that list on my RAP plan. Have you guys have heard of a RAP plan, right? Okay, she's on my RAP plan. So my grandmother lives with her, so she'll be there the whole time, or I can ask her to stay the whole time.
How
Okay.
about
So
this? How about,
Go ahead, Victor.
can you have your auntie pick you up and you all go to your grandmother's and your cousin come over there to visit you?
I can ask her. I can ask her to, because she will be. Yeah, she's not gonna, and she doesn't like that. She doesn't like that boyfriend either. So she wouldn't even let him in the house.
It's solved. No, I'm just kidding.
And it's always, yeah, we'd like to think that they're always, but there are some times where you have multiple. Think of families. I mean, we're coming up on a nice family holiday. There are lots of family folks that we can't wait to see. Probably
Right.
one or two family folks that we can't wait to see. But families are, we don't ask for families, we're given those. So
And for the and not to play devil's advocate, but and I can only attest to my own experience. Early on, I never got in a vehicle with a person that was actively using because I couldn't control my destiny. So, and they're gonna do what people use do, and they're not gonna respect the fact that I'm in recovery.
they may be jealous that you're in recovery.
yes,
But initially, but later on down the line, those same people, once they knew I was in recovery, they started respecting my recovery. But it was only after, a significant amount of time. But
Right.
I had to protect myself. So even like the question of I want to go see my cousin and they're actively using, should I go? Absolutely not. That's what I used to say to myself because I can't control the
And we
situation.
realize now that when we move kind of the harm reduction, that we do
Mhm,
allow the client to do their own decision making, but we want to
mhm.
guide them into making better
Right,
decisions.
and I get that part. I'm just saying personally that was because all my brothers and cousins and everybody was still actively using.
Mhm.
So, and
And maybe back then you may not even have had the option. So here's the discussion. You have 2 months, and I hear that you want your grandmother to see you in a good place. Does somebody at grandmother's house know how to do Zoom? So you can
right.
Zoom with her and talk with her since
I,
you wanted to go to visit her on her birthday?
I was going to suggest that some of the things that I suggest when I with newly sponsees that have months,
Mm-hmm.
I suggest before you go, how about going to a meeting first and just putting it out there and see
Mm-hmm.
can you get some more other suggestions.
Yeah.
That's the first thing because we tend to have a tendency of living in our own head, and our way is right. There's no other way.
Mm-hmm.
So how about going to a meeting? Hey, call your sponsor just before you go get on the train, the bus, or whatever the case may be,
Exactly.
and run that by your sponsor.
And we have such cool technology to do it now. Text them when
Yes,
you're there. You know,
Mhm.
just text.
and
text.
and go and also go to a meeting when you get to that town.
Mm-hmm.
I know sometimes things that have been helpful to me is like doing a kind of a role play type of thing too. As a counselor, I can play that cousin, come on, man, just one more time, get high with me just this one time. It ain't gonna hurt you, what are you gonna say? Once again, kind of rehearsing those scenarios.
Exactly. And you practice. You led to my next slide, Ben.
Sorry.
Practice. No, you did it. That's timing. Practice. Practice. Have the client role play. using the correct decision, getting feedback on how it worked. Ask them to discuss the pros and cons for each decision in that pathway of going to visit somebody. Ask how, now what's your cousin that's still using our boyfriend gonna say? You know, oh yeah, you think you're something, you think you're better than us now. Because sadly, when folks are using, sometimes we have a little bit of crab in the barrel. If we see a crab trying to raise up out the barrel,
Yeah.
sometimes might try to, pull them and grab them back. How would you evaluate that decision? If
Yeah, a lot of people don't want to lose their road dog. You know what I mean? Someone that they used to hang out with, like had a consistent using relationship, and they just want their buddy back. And if you're trying to change your life, that means that you need to kind of make a decision whether this individual is positive and good for your life, or whether it's gonna bring you harm.
And so that decision tree is so helpful in helping people move past those thoughts, getting over the feelings. Well, what if I let her down? She's going to be mad at me if I don't come. Okay.
And
So, mhm,
if I may, for the sake of conversation,
yeah.
you're clean. You got 60 days. You might have a couple dollars in your pocket. How you gonna respond to when they ask you to give them a couple dollars so that they can
Thank you.
get high?
And they will,
You
and this area here of the feelings, that is a large part of that. They may feel, okay, I may feel bad if I tell, so how are you going to manage that? What's the
right.
pros of going along with her and using? Oh, well, no, because I'm going to give up my 60 days. Exactly. So how can you get past those feelings? Because they may, and someone else who's using knows how to tug on your heartstrings too. So how are
Yes.
you going to keep the good behaviors that you've been doing, even if they're trying to play on your feelings in a negative way? I'm just going to go sit with my aunt, and my aunt will tell them, y'all leave her alone because she's getting her stuff together.
Absolutely.
So, and then will you feel comfortable letting your aunt kind of shield you a little bit from that? Yeah, I will. Now, will you not feel like she's not going to call you a mama's baby or anything like that? If she calls you that, what are you going to say? Well, I'm mama's baby, but I'm a clean baby today. I'm not using. Or what are the positive things you can say? I'm going to have one more day today. When I leave and go back home, not only will I see my grandma, she'll be proud of me. So that'll help my self-esteem. I'm going to take my self-esteem of having 61 days back over to Chicago. And then all of those you help, because what you're having to do is rebuild somebody's ability to feel good about themselves in their own mind, and not having others making them feel good or bad about themselves. Because when we
Dr.
use, we
Sora.
get into those things. Yeah.
So for me, early on, I could be like I was in a totally different.
Uh-oh. Richard, did I lose you? Or who was that asking the question?
It's Eric. Can you
Eric?
hear me?
Oh, now I accidentally muted you, Eric. There was I was hearing some background noise and I was trying to see who it was. Sorry.
Oh, I apologize. It wasn't
That's
my
okay.
hand. I don't
Go
know who
ahead.
that. But I remember being in a different city, working my program through, and something happened to Chicago. And when I got into my familiarity, like where my stomach started flipping, all kinds of things started happening to me physically and psychologically. When I had no thoughts and I had good intentions, as I got closer, the people and the place where I used, those things started happening.
And so sometimes it's not going to a city or a place or a location where it's still too emotional for you until you can get those negative thoughts, the feelings that might lead to triggering behaviors under better control. We're still going to be, that's part of why there is no cure. There's always long-term recovery, because we're always going to be working through these thoughts, these feelings, and using good behaviors, not behaviors that are causing problems.
Have you ever heard that before?
That
Like,
the place would cause that, going to a place would give those same.
yeah.
It's that same conditioning. Remember how what we talked about in that where you teach a dog to sit and then you give it a treat.
Mhm.
If
Yeah.
you do that so many times, the dog will start to salivate and you haven't even given it the treat yet. So you go to that city, it's happened so many times, you start to get those feelings and you haven't even had the experience yet because your brain associates that location with those experiences.
Exactly. And especially like in my personal experience, like if I'm like hurting for money and I go
Mhm,
back to that old place, I
mhm,
already know that there's individuals willing to like help me out, quote unquote.
right.
And you got to kind of think about that as you're you know, directing your client in that way, you know. I mean, is it going to distract you if you don't have much money when you go?
Right. And that may be something that you have to kind of do the prevent defense on. And when patients are looking at that, I said, okay, what's our prevent defense? Some of you guys like football, you've heard of that. Well, what I'm going to do this. I've got my auntie there. I'm not going to go in that other neighborhood. They're not going to take me over there. I'm not going to head on to that area because I know that's the area that's not that good for me. I'm going to stay with my auntie. If my cousin still tries to bring that boyfriend, tries to ask me to go with her for somewhere, I'm not going with her by myself. So I have all the prevent things. And when you practice and then reward the client, because even when they go and come back, well, yeah, no, I didn't use. They're gonna be like, no, I didn't use. You didn't use, yay! And you have to celebrate because people who are when we're using, we're like, yeah, I didn't use. It's no big deal because we're not used to giving ourselves the good kudos. We have to learn to do that exercise that I call raising your hand up and patting yourself on the back because we don't give ourselves those attaboys when we need to. Now, I've got a couple of slides that showed some of the slides from last time and how those remind you, don't use that all or nothing thinking, jump into conclusions. So, and reminding you to challenge those cognitive distortions that clients may have because they're always helpful in, okay, is this real? What's the evidence that that really is true? And what's the worst thing that can happen? What's the best thing that can happen if you don't use? And then what's most likely to happen? What can you choose to help happen? So reminding clients to use those coping skills. There's some great links that you'll find when I send the link to you guys on handouts that you can have, just like Ben had folks writing things down. These handouts are worksheets. So they have the client, what am I going to do for this? What if I feel triggered? What will I do? So those are some nice handouts that they can have to use as well. There are even apps that you can have and utilize. And remind yourself, always do a mood check when you're checking with your client. Because if you start a day and there's something positive that's going on, you want to always reorient and boost that up. Going over the activities from your last time you talked with them, talking and training them in a new technique, and always using the role play. Because I've actually had clients say, hey, I did the role play. They asked me that same question you did. They asked me the same thing you did. And I used the role play. And you'll find the joy in the clients being able to use those skills that they're learning and to follow up from that. Because clients, as they become aware of those internal processes, those triggers, that's a strength that they didn't have before. You're teaching them a strength that's going to help them to have one other day of not using. That's one of the best things that we can do. And we know that with CBT and practicing, we can train that conditioning just like we train anything else. We train our husbands. Yes, we do. We have to if we want to keep a good one. We have to train them. Sorry, guys. Hey, we help them understand those thoughts progress to feelings, progress to behaviors. And we want to always highlight those good behaviors. And when people and our clients understand those, that's a power that they never had before that gives them a lot of strength toward their recovery. Some free apps that are helpful, because I know we need to end a little bit, are I Am Sober. Sober Peer is a CBT AANA based app There's a CBT for opioid use that actually gives clients kind of pops and positive reinforcement as part of that reinforcement training, just as part of using the app. So if someone has a phone or a cell phone, or younger folks that might be in treatment that like to be on their phone, you can give them something positive to use to reinforce the work that you've been doing with them. And then ask the client, hey, was this helpful for that worksheet that I gave you? When you went to go and visit your cousin, did that help? How was your grandma looking at you when she saw you had 2 months sober? What did she say? Remind them of those things to be positive for. Because we know that motivational interviewing, CBT, can really help to empower a client towards making those behavior changes, increasing those triggers, and working to decrease their substance use. So CBT really helps to restructure your brain so that you have new thinking, new pathways, and new rewards for the positive things you're doing as part of your recovery. So we talked about several tips that you can use and that you can help to dialogue with your patients and dialogue with your clients as part of their recovery or part of your own recovery. So I hope that these last 2 sessions for CBT and relapse prevention have been a good start for you. As I said, we're always happy to come back and do more trainings and to hear your feedback and your questions on how it works out in the field. Okay. Do you guys have any